This is the Adult Education Senior University session, Understanding Senior Living Options with Christianna Smith. She is an Oasis Senior Advisors of Northwest Indiana, and so we are very happy to have her with us. Thank you so much for joining us.
Well, good afternoon, everyone. Thank you so much for being here today. It's an honor to be here to present to you all. Like she said, I'm Christianna Smith. I am the owner of Oasis Senior Advisors of Northwest Indiana. I'm a certified senior advisor. I have worked in the senior care industry for over 25 years in various roles, but always in a helping role, trying to help seniors and their families. That's my passion. So that's why I'm here today. So this is going to be just a general overview, but I wanted to start with some statistics that I think are a little eye-opening. The number of Americans age 65 and older, as we know, is increasing, with the 80-plus age population projected to grow by 14.7 million people in 2025 alone. This year, 73 million baby boomers will be age 65 plus. Of course, we're living longer, so the average life expectancy is now 79.9. And then after age 65, roughly 70% of seniors will need some form of care or assistance. So that's a lot of people that are coming down the pipeline. They're calling it the wave, that are going to need help and care as they age. So benefits of senior living. Enhances your quality of life, provides for maintenance-free living, promotes safety, well-being, social connections. It addresses people's physical, emotional, and medical needs, reduces caregiver stress, and prevents burnout, and aligns with the desire for, I think, most seniors. They want to have dignity and as much independence as they can as they age. So what are those senior living options? Of course, one is to stay in your home and age in place if possible, but that's not always possible for everyone. So we're just going to do a general overview of then what other options there are. One would be moving to an independent living community. There are also what they call 55 plus senior housing. Those are not quite independent living communities, but they don't provide as much as the independent living community, but it could be an option for someone. Assisted living, memory care, what we call a CCRC or a continuing care retirement community, and then we have our skilled nursing facilities. So the first one, independent living. So generally, this is for your active seniors that need no to minimal assistance. They're still driving. They're still able to do all their activities of daily living themselves. Most of these do have dining options so that we don't have to cook anymore if we don't want to, or maybe at least one meal a day. They have lots of activities going on for us to be social, bingo, cards, exercise classes. Some of them have transportation options if we maybe need some help with transportation. And sometimes they have the options to add help with laundry and some housekeeping, maybe every other week, not as often, not as frequent. They don't provide any medical care though, so they're not going to provide you with any medical care. If, a lot of times you can still on your own get an emergency response button, but still when you push that, just like in your home, it's going to call 911. It's not going to call the staff there. The staff there are not there 24 hours a day. They're not there to provide any medical care. And again, this option would be private pay for that option. So next, assisted living. This is more for those that need help with those activities of daily living, or what we call ADLs. You get some personal care. Maybe you just need help with the shower. Maybe you just need somebody to be there while you're taking a shower, for safety, help with medication management. Meals are going to be included. Housekeeping is going to be included, and it's probably going to be weekly, and laundry is going to be included with that. And there will be staff there 24/7 that are available to assist you if you need help. And most of those places have a pendant or a button that you wear that you can push that's going to call and alert the staff there that you need help. So it kind of combines independence with the support you need. So you can still be as active and independent as you want to. There's still can drive and do a lot of this stuff, but have the care you need. Most again, you're going to private pay. In some cases, Medicaid, especially here in Indiana, there are some good Medicaid options when it comes to assisted living, and then of course long-term care insurance to help pay for these options. Memory care. So similar to assisted living, but it's more specialized for those that need Alzheimer's and dementia care. It's a secure, locked environment, and that has a little bit more structured activities. For those, the staff is usually trained and have special training they go through for more cognitive support. It's usually a part of an assisted living, but it also can be a standalone building and be by itself. Again, private pay, in some cases, Medicaid, and long-term care insurance. And then we are on to what we call a skilled nursing facility, or a SNF. You may hear it there. So there's kind of two pieces to this level of care. You have your short-term rehab. So if you're in the hospital and then you need rehab, you might go to a place just for a short time. Your insurance is going to pay for this piece, your Medicare, your supplement, whatever insurance you have is going to pay for a very short time for rehab. And then you have your long-term medical care. So 24-hour medical care. It's more a hospital-like setting. The rooms are more hospital-like. There are private rooms, or could be a semi-private room. But they're going to provide all the care that you need there: medication management, stabilization. I didn't put it on the screen, but you get more into a higher acuity level of care if you have IVs, just complex medical situation. And these are licensed by the state, of course, and they have licensed medical professionals, covered short-term by Medicare, Medicaid. There are some places, some skilled nursing facilities that don't take Medicaid, and then private pay and long-term care insurance. And then you have your CCRC, or your continuing care retirement community, or what they call a life plan community. This is a little complicated, but usually it's a place that has all of those care levels in one. So it's going to be usually a large property where you have independent living, you have assisted living, memory care, skilled nursing, all together on one property, and you can kind of, move in and then kind of move as you go and you age in the care that you need. Usually these are very, like I said, large. They have a lot of amenities. I've worked at one in the past where we had a pool and a fitness center and a putting green, and we had lots, walking trails, and a fishing pond. Some of those are a month-to-month rental. But the majority of those are life plan, and you do a significant entrance fee to pay in, or buy in, to that. And then they use that money then again to kind of go with you as you age and move to different levels of care. So the average cost a month is going to be very similar to a non-life plan place. it's just a little bit, it's kind of like a long-term care insurance policy, sort of, that you're putting this money into, and then they're caring for you as you age. And there are some, I'm not going to get into it, and I'm not an expert, but there's some federal income tax benefits to that too. So, all right. So some key considerations when you're choosing a place, location, very important. How close is it to your family, friends, places that you're familiar with, your favorite restaurant, your doctors? All those things are important to be close to that in proximity. Cost and budget. So when you're thinking about this, understanding how their pricing structures work, are there hidden fees, what financial assistance they have, if base rates versus level of care. You may have an assisted living that all of their care is inclusive, and you may have one that this is their base rate, and then they add on for every little extra thing that they do. So you have to make sure you're comparing apples to apples when you're looking. And then the level of care that you need. So looking currently at what you need, and then anticipating future needs, medical, personal. So again, if right now you're pretty independent, but because of a diagnosis or whatever reason, you are going to need more care. Maybe look at a place that has multiple level of care, so you don't have to necessarily move and then do a big move again. You're just able to stay and move there on the property. Amenities and services, what's important to you? Is it important to have dining, activities, transportation, health care? It's important for you to have religious services, whatever that may be. Look at what amenities and services they have. And then the culture and the atmosphere. Are residents engaged with each other? Are they enjoying themselves? Are they out doing activities? Is the staff friendly? How is the overall feel of the place for you? Is it homey? Is it a lot of these brand new places are very nice. They look like hotels, but that may not be comfortable for you. I mean, I like to stay in a hotel every once in a while, but I don't know if I want to live, in a hotel. And then again, their accreditation, their licensing, ensuring their quality and that they're following the guidelines by the state and by the government. They're doing what they're supposed to be doing. Pricing, and again, this is going to be very approximate and kind of based on Indiana averages. And my numbers moved around here a little bit, but independent living generally, you're going to be anywhere between $1,800 to $5,000. Assisted living, and I know these are big ranges, but $2,500 to $6,000 a month, and this is all monthly. Memory care, $5,000 to $9,000, and skilled nursing, $8,000 to $12,000. So I wanted to talk a little bit about important questions to ask. So if and I feel like everybody, and you're obviously, by being here today, you're a step ahead of most people. You're thinking about it, but not to wait till there's an emergency, until you're in the hospital, or you need the care. Going and seeing places now and making sure that your family and those that help make decisions for you no, this is my first, second, third choice, A, B, C, and D. But when you go, make sure you have ask questions. What level of care does the community provide? Does it only provide independent living? Well, that's probably not going to be for me if I need help. Because then I'm actually going to have to be also bringing in extra care, which is going to cost more money on top of what I'm already paying. So how does that community feel when you walk in? How does it smell? How does it sound? All those things. What amenities and services are included, like we talked about, in that base monthly rate? And then what are additional costs for care? Does it cost extra for cable? Does it cost extra for my phone? Those things that are important to me. And then what type of training has the staff received, as well as the frequency of that training, especially, like I said, when it comes to memory care. You want the staff to make sure they're up to date, with their training, with their CPR, and not just get it once, but they get it continually on a regular basis. And then what is that ratio of staff to residents during the day or the night? Are there staff there during the night when I might need help? And then dietary restrictions. We have a lot more people nowadays that have allergies, gluten intolerances. Maybe you have some sort of religious, you know, food preference that you have that, is that community going to be able to accommodate those, or especially even the diet textures? Do I need the texture of my food modified for whatever reason? How often are housekeeping and laundry services provided? How frequently does the facility communicate with families about someone's well-being? So, if I'm in here, how often are you going to communicate with my family to let them know what's going on? I mean, are they going to be a part of that decision if I want them to be a part of that decision and know that information? So, and then do doctors and nurses make their rounds, and who are they? Do I have to change my doctor? Can I keep my doctor? I've been seeing the same doctor for 30 years. It's important for me to be able to keep that doctor. And then how is the community secured? Like safety, do they have locks? Is it locked at night? Gated? That would be really fancy, but what are their safety methods? How do they handle emergencies? How is technology as part of that? There's a lot of places that are added not only, the call button, but also some fall detection features to those. One community that I've toured recently had like a camera, and it wasn't a camera that it was watching all the time, but if somebody did fall, it detected that change in plane, and it would come on to record a few seconds of time, so that staff could then see what had happened to provide more information to the staff and how they can maybe prevent future falls. I mean, was it just somebody slipped out of bed, or did they actually fall? So there's lots of technology that's coming down to help. Um, and I think for the biggest thing is that it's okay to ask help from others. You all are here today, so you're all doing that, but join a support group. There's lots of support groups for various types of, there's Alzheimer's, Parkinson's, um, just caregiver support groups, but also seek advice from professionals. So like myself, I'm a certified senior advisor, but then there's also certified financial planners, elder law attorneys, your primary physician, insurance specialists, and there's a lot of people who help with move and downsizing. For a lot of people, that is the biggest hindrance to them moving, is stuff. And how do I deal with my stuff, and what do I do with my stuff? And there are people out there that's what they do. They help people get through the stuff so that they can live better and more independently. And then check out community resources before you need them. So again, you are all way ahead of the game because you're here today and doing this. And so then just a little bit about what I do. So as a certified senior advisors, I try to make the process a little more simple for you. It's a free service. I do an in-depth consultation to kind of identify your personal preferences. So what is important to you? What type of care do you need? Funding options. What is your budget? We're not going to go look at places that you can't afford. 3, personalized. So then I give you a personalized list of those options that meet all those criteria. And then if you want, go with you to tour those communities, kind of like a real estate agent for senior living of sorts. Some people prefer to go on their own, but I'm there to walk with you and do the tour, maybe helping, think of things that you're not thinking to ask. helping with that. And then you select your community, and then hopefully you move in with ease. But again, I also have resources then for moving people, real estate agents, all those other things that you might need during that process. All right, that's it. Thank you.
Thank you so much, Christiana, for that presentation. We can go ahead and start with questions, and we can start with the people in the room.
She's asking in Illinois, there is a kind of a separate class that we didn't talk about that is called supportive living. There are some states that call it more like a residential care home. So Illinois and Indiana have differences. Yeah, that doesn't exist in Indiana. There are a couple what we call residential care homes that are starting. There's like, I know for a fact there's one in Crown Point and there's one in Lowell. But it's kind of a new thing in Indiana. It's more of like a house setting. There's only like 16 people that live there, but it's not for everybody. So they are not licensed. They don't have to be licensed, but that's because they are not um, they're not administering medication. So the family still has to set up the medications and take care of all of that. And staff is just there to do medication reminders. So that is not going to work for everybody. I apologize, I'm not an expert on Illinois and that supportive living piece. But if you are interested, I could, I do have Oasis Senior Advisor partners in the Chicago area who are more experts on that, and I could get you some more information. She's asked about the new residential care homes and more like the privacy of those. That each person does have their individual rooms. Some of them you may share a room, depends on cost, but generally those 16 people have their own bedroom, bathroom, but they do share then all the other space. They eat together, living room. Here in Indiana, it's called a residential care home. But again, there's not a lot of them. I've lived in other states before. It's a very big model in Kansas, where I was. Wisconsin has a lot of residential care homes. I've seen them as small as 6 or 8 people. And literally the ones in Kansas, some of them look like a home, like you would drive by because they took a home and remodeled it and made it into this. You wouldn't know it was anything else. She's asking on the different levels of care. When I said sometimes Medicaid, like assisted living, there are going to be some assisted livings that they don't take Medicaid. They're not licensed for Medicaid. It's just not an option. It's say with memory care. And they're, like I said, even at all levels of care, really, skilled nursing. And you go there, you run out of money, you're gonna have to move. But then there are some that take Medicaid waiver, but they have a limited number. And so they want you to come in private pay. And as you spend down your money, they want you to be able to stay. And then there are some that have lots of Medicaid, apartments, or every apartment is, and they can accommodate anybody. Okay. Other chat questions?
All right, yeah, we've got a couple in chat. So, first off, can you talk about how senior advisors are certified?
Sure. So I personally got my certification through the Society of Certified Senior Advisors. So it is an exam that I took. There is lots of online study and things to go through, along with all the experience I've had over the last 25 years. But then you take an exam and then you get that certification. I also have to then ongoing have 30 hours of CEUs, continuing education, that I keep up to keep my certification.
Right. And then another question is, are there websites where people can review care in the various housing types? And if so, how would we know if these reviews are objective, or how we gauge what we're reading, if this even exists?
Sure. So, obviously, you can Google and, and there are reviews, but those are all, I think to take those with a grain of salt. I think the best way to know about a place is to go see it yourself, to talk to friends, family, people who have experienced it. Because like any other restaurant or whatever, if we have a bad experience, we're more likely to go on and do a review than we are if we had a wonderful experience. They're only with skilled nursing. If you would go to medicare.gov, there is a way to search for skilled nursing facilities anywhere by zip code, by city, and then they have a system where they rate. So every skilled nursing facility has the state visits and does, a full assessment of that facility. Again, those a little bit with a grain of salt because it's the government, and so they're not always completely up to date. So you can't always totally go by that, but you'll be able to see those reports, see what the findings were of those assessments. They don't really have that for assisted living and independent living because independent living is not licensed. So um, that's the only one that I know of, Medicare.gov for skilled nursing facilities. She's asking about the licensing of all the levels of care. I did talk a little bit about the residential care homes here not being licensed. But yes, if it is an assisted living community or memory care community, it is licensed. There's still something to ask, and you can even Indiana makes it pretty easy. There's a way to, if you Google, there's a way to go to the state website and you can get a list even by county of the communities that are licensed. Um, like I said, independent living is not going to be licensed, but because they're not providing any medical care. There are a few independent living models that are independent living, and then they utilize a home health license or home health agency to kind of provide some additional care for their people, but they're using that under that home health agency's license. They're not their own license. But in general, an assisted living, a memory care, skilled nursing, those are all going to be licensed.
Thank you so much, Christiana, for taking the time to share this information with us. It was a great overview of, I know, of complicated topics. So once again, thank you so much, Christiana, for taking the time to be with us today.
Thank you.